This week marks another significant milestone in our coronavirus testing programme with the on-site delivery of our COVID-19 laboratory right behind me. And I'd like to thank Jersey Aero Club and Ports of Jersey for the part they have played in finding a suitable location. Our current testing programme sees the majority of tests processed off-island. Because of travel time, it on average takes around 30 hours to get a result, and that could be longer if we have bad weather. The new laboratory, as I said, right behind me, will rapidly process a high volume of tests, around 2,000 a day, with results expected within only 12 hours or better. The lab was expected to come into use in September, following a period of testing and obviously validation. And having the new laboratory up and running ahead of the autumn, when off-island travel is often disrupted by bad weather, is critical to effectively manage the island's testing requirements. The lab will process tests from symptomatic people, care home admissions, pre-operation patients, essential workers and passengers arriving the island via our borders testing programme. A faster test turnaround, along with contact tracing, compliance monitoring, daily decisions about country classifications and our own behaviours, including maintaining social distance and good hygiene practices, is helping to keep us all safe. We'll continue to provide regular PCR testing to frontline healthcare workers, and we're also developing the next phase of PCR testing for islanders. We've also tested more than 40,000 passengers arriving in our island through our borders testing programme. And in the last few weeks, there's been a significant increase in the numbers of tests being completed as countries are reclassified in line with our country's risk assessment. We are actively looking at a regional approach to the country's risk assessment and expect to provide an update on that work in the coming days. In total, of the 40,465 inbound arrivals tested since 1st of July, only 25 positive cases of COVID-19 have been identified, and of these, none have been hospitalised, and there have been no clusters or onward community transmission. And despite the additional numbers of tests being completed with passengers on the 5th day following their arrival, the number of positive tests identified at that stage is currently so low that we can't provide further details without compromising patient confidentiality. Every positive test we have identified has led to the traveller isolating and contact tracing taking place. This is how we are effectively managing the risk to our island and ensuring Jersey remains open to tourism and to trade. Our testing and tracing process is robust, effective, and has actually been held up as a good example by other jurisdictions. And this lab is another critical tool to see that good work continues. Thank you very much for listening, and I hope it was of interest.